welcome back to our channel. If you're not following us, please click the link and follow. If you haven't subscribed, please subscribe, as we will be sharing quite a lot of information which you find helpful. So today's topic is how to start a nesting recruitment agency. So there's 5 phases which we use. Tried and tested methods which were formed by, which we actually developed in our organization, the Healthcare Business School. The 5 phases include the startup phase, and then we've got the compliance phase, we've got the logistics phase, we've got the marketing phase, last but not least, we've got the contracts and tenders. So on the first phase, the startup phase, this is where you need to have your checklist of identifying the business model. Because yes, I might have said nesting recruitment, but do you really want to recruit nurses, or you're more leaning to recruiting care agencies? So we need to be clear there on identifying our business model. We then come to the registration of the company's house. Are you on company's house? You also need to ensure that you've got the right business plan in place. Yes, like just any other business, you need to understand your business plan, do your research for the area that you are in, do your financial projections, and understand if how the business is really viable. We come to the other things like the likes of, the other things like the likes of understanding the costs that comes with the setting up and the expenditures. Do you have the right money for your staff? I also talk about the things like how do you intend to pay staff, where we could be talking about invoice factoring. Again, that's your phase 1. We come to the second phase, where is compliance. It is a heavily regulated business. It's health and social care. So we need to have the right paperwork in place. We've got we need to have an insurance where we need the indemnity cover. We need public liability. We need employer's liability. All these, you can set them at 1 million each. Like when we're doing your quotation, they will always vary depending on the client that you're working with. You also need to have your policies and the procedures. So in this case, it will be more of your HR policies. How do you intend to recruit your staff? What is your DBS policy? What do you what process do you use to conduct the DBS? How do you, do you ensure that you practice your equal diversity policy? So there's quite a few policies that comes under, within on the HR listings. So we also have the other things that you might also want to consider: the paperwork, the welcome pack. Or should I start with the introduction pack? If you were to approach a nursing home, what have you got in place to present yourself, to present to them? Because obviously you start by calling them, but then they would ask you to send them maybe like an introduction letter. But what do you put in place? So this is where you attach the rate cards. For those who don't know what rate cards are, it's actually the rates that you will be charging the nursing homes, and then we've got the rates that you'll be charging you'll be paying your staff. You also have the terms and conditions. Yes, you'll be working with the nursing homes. Usually, most of the time, they usually really kind of like the best working in your terms. You need to decide when to, how much time do you give them to, when it comes to shift cancellation. What happens when they decide to keep some of your permanent staff, or some of your temporary staff, keep them on a permanent basis? So again, these are your terms. So these terms, try and make them to be flexible. You can always negotiate with the client, ensure that you also meet them halfway. For example, if you say, our fee rate, the introduction fee, if you decide to keep our permanent staff, you might start at 20% or 15%, but then the client might say, you know what, can we meet us halfway? 15% might be reasonable, or 12% even. So again, these are the T's and C's that I'm on about. Then you come to the other paperwork where you can have the handbook. There's things like the client handbook, where you can also, once they become a client, you give them something nice for you to presentable in a brochure or where you've got your complaints policy on it. Again, you've got another handbook, which is the staff handbook, where they need to read and understand your terms. So again, it's more like a summary of your policies. That's your compliance done. You come to the logistics. Yes, we need to have the good logistics in place. We should be able to present ourselves in a sense that we are align with compliance, be more productive. So here we talk about the systems and processes. What systems should we have in place? We can talk about the likes of the care management software. We can talk about the likes of maybe the logistics, the office space. What do we need to put in place on the office space? So all those are kind of things that you need to consider on the logistics. Finding can also be added onto this onto the third phase. So again, you need to weigh, how do you source your money? Are you going to be self-funded? Are you going to be looking for loan? All these are the things that you need to put in place. We come to the fourth phase, which I usually kind of like marry the two phases, the marketing and the contracts. Yes, we need a website. We live in a digitalized world. Your clients who might want to find you on website. This is the phase where you are now set up. You're now thinking of, you've got your nice branding in place, and then you also need to look into how do you then promote the business. Are you also going to be looking into social media marketing? Are you looking into Google Ads? There's quite a lot of few things, various ways of marketing the business. But then we come to the last but not least, where we talk about the contracts. Where are you going to be getting those contracts? I've already covered the nursing homes being an example, but there's different ways of doing that, where you can do that.